Hello, everyone, and welcome back to the MedBoys podcast. For those of you who are here for the first time, my name is Nimit. I'm a third year medical student at U of T, and this is Rushal. He's a second year medical student here at U of T. Joining us today is Dr. Praveen Sritharan, an orthopedic surgery resident at the University of Toronto. He's received both his undergrad and medical degrees from McMaster University in Hamilton. Outside of medicine, Praveen's a gamer, he's a sneakerhead, and he's even tried his hand at barbering back in the day. He's here to share his journey, insights from the residency grind, and what it's really like to be inside an operating room. Let's dive in. Hey Praveen, how's it going?
I'm good, guys. How are you?
Good, good. I'll let Rushal start with the first question.
For sure. So thanks for coming on, Praveen, today. Our first question for you is kind of just a little bit more insight into what first drew you to orthopedic surgery and how has your perception of the field kind of changed during your residency?
Yeah, thanks for having me on. I really appreciate the chance to talk about some of the experiences I've had. I guess to start off, like ortho is definitely something that, was something that I switched into later on in medical school. I was interested in like a wide variety of specialties throughout my years, like psych, plastics, anesthesia. Like I try to have my hand at a lot of stuff. It's pretty funny because like in pre-clerkship, we'd have like these like end of like our blocks, like our staff that would kind of lead our small group sessions would take us out to dinner or whatever, and then they'd try to like predict what specialty we'd end up in. And I always thought ortho, which was something I didn't really like. I didn't really agree with that first, but it was pretty funny because I ended up like going into ortho. But I think a lot of it has to do with one like kind of it being a surgical specialty. I think me wanting to do something with my hands and like something procedural has always been something of interest to me. I wanted to spend time to like master, like a craft, and it kind of made sense given that, I'm someone that does a lot of hands-on activities, some of the ones you mentioned, but also like big into basketball, for example. So I really enjoyed that aspect of ortho and kind of leaning into that. The patients, they're really motivated, and I found that at least in my experience and the ones that I've like talked to in terms of like the ortho surgeons that I've worked with, patients are really motivated to get back up on their feet. Mobility is something that we all value for so many different reasons. Like there may be like that 15-year-old that just wants to get back to playing basketball or soccer, or like there's people that rely on mobility to work on a day-to-day basis. And that makes a large proportion of like Canadians, right? The elderly population also relies on mobility to kind of, do a lot of the things that they enjoy and bring meaning to their life, like at those later stages. So it's really cool having those conversations in clinic as well outside of the OR, just hearing about people's reasonings for wanting to get back, and everyone is so motivated, which was really nice. Not to say that I didn't find that in other specialties, but I think ortho is just one of those ones where I just personally found it really like enlightening to kind of come into clinic and hear those stories. So a lot of, people may say like, the clinics in ortho are very fast paced, and like they definitely are, but I actually really enjoyed kind of my interactions in them as well. And that um, drew me to the field. In terms of what my perception has been since I've come to residency and how that's changed, I think there's a lot more that I've been exposed to in terms of like the principles of orthopedics that I didn't like. This is like very content based, but like the biomechanics, like especially like doing your arthroplasty rotation as like an R1 at Toronto, for example. You learn about like knee alignment, hip alignment, like the different types of axes, like something as basic as that, right? Like those are things I didn't necessarily appreciate as a medical student, for example. And it actually is something that is really cool to like look into. And it's something that's like adjacent enough to medicine where you feel like you're learning something like so, like native to like what you kind of learned in medical school, but at the same time, it makes sense in the context of like human anatomy and stuff. So that's something that I've really enjoyed, but has definitely been like a change in perception. Like it's very biomechanics focused in a
Yeah, and what you were talking about earlier, Praveen, I actually experienced that firsthand a few months ago. My grandpa has always been like a super active guy. He like walks around all the time, exercising all the time. And then like a few years ago, he like was like diagnosed with like osteoarthritis, and that really, really hindered like how he got around, how confident he was in going out and stuff. So he stopped really going out and doing the things that really brought him enjoyment. And then a few months ago, he got both his knees replaced, and now he's like back to normal. And he's so much happier than he was. a couple of months ago. So it's like a simple operation here and there. Like not to say that it's technically simple. It's probably way harder than it looks. But it can bring a lot of joy to people. And I feel like that would be very gratifying.
Yeah, like I think, it's there's so many subspecialties in ortho and like a lot of them have different types of themes in terms of like the conversations that come up. But like that is a very classic example of someone that, is in an arthroplasty clinic. Like, they're a little towards the older side. They're not people our age, for example, but they still, value kind of being able to get up and go on walks or, like just get their exercise in and that being taken away from them it definitely like impacts their quality of life a lot more than maybe the general public thinks so yeah.
Hmm. Hmm. Yeah, yeah, and that's tied to a lot of like psychosocial factors as well about how they go about their lives and how it in the long term impacts everything around them. So that's a really cool thing that you mentioned. We're talking about medical school, and the match just happened a few days ago. A very like exciting time for all the fourth years. I know matching into ortho has historically been pretty hard. So how did you kind of set yourself up? You said you pivoted to it a little bit late. So were you scared at all? What were you feeling?
Yeah, I think, like kind of when I pivoted was towards like mid clerkship, I'd say for us. Like I went to Max, it's a 3-year program. We do like a year and a half pre-clerkship, basically like a year and a half clerkship. So I had about like 7 months before applying to CARMS, I guess, when I actually decided I wanted to go into ortho. And I didn't have much clinical experience under my belt. I'd say it was definitely like, pretty nerve-wracking because you kind of go in with this plan. I mean, not everyone figures it out, obviously, but personally, I'm someone that, thought that I would go into medical school, figure it out early and just kind of, cruise through, not cruise through, but just, like have things controlled. But I realized, if I knew that this is the choice that's going to make me happy in the long run, it's worth taking the risk. And yeah, like the word competitive is relative. Like I mean, like I'd say like all specialties have like, like a lot of people wanting them. I'd say ortho specifically, like it's a smaller specialty. There's not as many spots in Canada. That goes for like any surgical specialty, to be honest. So, I think the most important thing about that is getting to know people. Like networking is huge. Like you never know what surgeon knows what surgeon, and like the reference letters that you get in CARMS, you never know like what, you know, the name of that surgeon could just be like the friend of someone at a different program that's reading it, right? So I tried to kind of go in with the mentality of like, trying to do as good of a job as possible with like every single staff, every single resident that I interacted with. I tried to show that I'm hardworking, and although I may not have like the same amount of experience under my belt as someone who maybe wanted orthopedics since day one, I'm willing to like pick it up and learn on the go. I think a big thing about like surgical specialties is also kind of like the interpersonal aspect. Like obviously surgery is a huge like it involves a lot of teamwork, whether you're in the OR with allied health staff or just within the team yourself of physicians and residents that are like running a service or helping run a service, right? So you kind of want to show that you're someone that's easy to be around, someone that can get along and mesh well with the team, and at the same time you can be yourself at that, like obviously, but I think like that's very generic advice, and then that I got and I tried to like implement. Outside of this, I tried to look into what my interests were even before I was interested in orthopedics and try to see how I could actually combine that into a career in ortho. Just because I switched into ortho late doesn't mean that the last 1.5 to 2 years when I wasn't interested in or when I wasn't as interested in ortho would have been like to waste, right? Like I had experiences that I could still draw on my applications and still talk about. Like I a big component of my residency application was like my advocacy in refugee health ever since my undergraduate years. And it's hard to see how that could be like tied to orthopedics at first, but there's a huge global surgery component to ortho that's growing and growing, and U of T is also recognizing that even more. And there's a lot more surgeons in our faculty that are kind of engaging with that. space. So I try to talk about that and how I, for example, would be able to hopefully use U of T's platform to try and get myself involved in that a little more. So you kind of just want to take what your interests are and mesh them into the specialty. Obviously, don't force it, but at the same time, if there are connections, like try to explore those and see. Which is why I'd also say it's really important when you're in medical school to explore things that are not just related to the specialty that you're actually interested in, right? Like try doing things like in the creative arts if they're interested in that stuff. Like try to keep up your hobbies because you never know when that stuff will come up in your applications, during interviews. Like they all will help you become a better surgeon at the end of the day. So that was also a big thing. And then the final thing I'd say is like I'm someone that is particularly interested in research. So I do believe that it was a component of my application that I did try to highlight and talk a lot about. So I try to get involved in ortho projects like that I when I knew that I wanted ortho for sure, I try to get involved in as many projects as possible. And then I also like fortunately had like very supportive mentors who were able to help me like, develop my own ideas and take it from like start to finish, which not only helped lead to like research productivity, but also gave me or showed, them that I am someone that can kind of like take a project from start to finish. I can be reliable in that sense. And it is a good avenue to explore if you do want to try and like, get interested in, or you are interested in kind of like academia and stuff. So yeah.
Well, thank you so much for the overview on kind of how you approached your application to ortho and kind of your journey to kind of discovering that. And I think your story really highlights that no matter what you do, whether you may not think it's related to what eventually you're going to be doing in the future, there will always be some sort of connection that you can form that can inform like your later career path. So I think that's a great way of approaching things. And I'd also like to kind of zoom in more on your electives. I know you mentioned that some of the strong parts of the way you performed in your electives would be to kind of like network and make a good impression on every resident, every surgeon you spoke to, because at the end of the day, you don't know who knows who and who's good friends with who. So I actually wanted to ask you more about how you kind of approached your electives and what you kind of did to set yourself apart from other clerks.
Yeah, that's a great question. So we were in like the year that the visiting electives were just like starting to roll out. So it was pretty difficult to get them secured from our end, to be honest. I was fortunate enough to be able to do one elective in Vancouver at their level one trauma center with UBC. So that was a great experience. I really wanted to try and get other sites, but it just didn't work out. And like I think the first thing I'd say is elective scheduling is probably going to be like, I don't know if you guys have experienced it yet, but it is going to be one of the most annoying things that you're going to have to deal with as kind of a clerk and, just waiting on schools to get back to you and then like seeing if it fits your schedule or not. And there's some things that are just out of your control. So be ready to kind of pivot, you want to go to XYZ programs, do an elective with them, but in the off chance that you may not be able to do it, just have a plan B. In terms of other things that I did to approach these electives, like when I actually did these electives, I tried to study beforehand. And like that goes for any rotation, regardless of what specialty it is. But I tried to study like very specifically into the subspecialties that I knew were kind of strong at those sites. So for example, if I knew I was going to a level one trauma center, like I would really study up my ortho trauma. Like anything as basic as like the principles of like fracture healing all the way to like like the principles of bone grafting, right? Like I would try to cover my bases because like you never know what's going to come up. And I think that was something that I tried to do. If it was arthroplasty, I would look into like we have like a resource called like the hip and knee book. I tried to look into the basics of arthroplasty. If it was sports, I looked into like, the basics of arthroscopy. Anatomy is very important to know, but I found that anatomy is one of those things where like it doesn't come up on a day-to-day basis where you can kind of like prepare for it overall just like by studying beforehand. Like it's important to study beforehand, but I found that the the bulk of my anatomy studying came from like, the day before I went into an OR and I knew what cases were coming up. So I'd kind of focus it to the actual ORs that I was scheduled in. Because again, you don't know those until like you don't know what ORs you're going to be in until you actually kind of are closer to the elective, right? And then the last thing is just like just functioning in as part of the team. I try to take a lot of call. I think that's a really important thing in surgery, just understand what call looks like at least. Like you're still exploring ortho, right? Like you want to actually show them that you are willing to see what it's like because like it is very different, like how call functions as an ortho resident compared to like, the daytime when you're in the clinic or OR. Like it's really important that you get the experience to do that. I particularly try to be on call as much as possible within healthy limits. And I think not only does that show that you're like a dependable member of the team, you're always willing to help, but also it helps you because you get to actually see more and more, which is why you're doing these electives as well, right? And then the final thing is in terms of like surgical skills, like, just I try to have like basic stuff at least, right? Like suturing, knot tying and whatnot. You don't need to like know how to use like, like a bone saw. Like if you like you don't there's not many ways to practice that as a medical student, obviously, but like I think the basics should be something that you should be at least comfortable with when you get to the elective stage. So I try to just even like instrument handling. Like there are some, staff and surgeons that are very particular about how you hold your instruments even, right? And which is very important. So like even just like holding it, I was practicing like while I was watching TV or like I was like, just like watching Netflix or something. I'd like have a needle driver in my hand and just like learn how to palm it, for example. So those are all things that I did from like a content, from like a work perspective, and then also from like surgical skills perspective.
And that seems like a lot, Praveen. Like that seems like you really worked hard during those months. It's like a lot. It's a large grind for like 4 or 5 months, right?
Yeah, it is. And like you kind of just got to go into it knowing like that's what you're getting yourself into, to be honest. Like I remember like I would yeah, I felt like I mean it's nothing like you're like when I did call, like I would still leave at 10 p.m. for the most part. Like I wouldn't stay there the entire night. Well, that's just because of how like the programs are structured or like how the electives are structured. But um, it is kind of like a very big difference because like you're not supposed to be there. You want to be there, right? And like it's a big difference, but you have to balance that with like, getting enough sleep so you can actually come on time the next day and stuff like that. So, yeah, I'd say also prioritize your health. Like try not to, slack on that, to be honest. Like I'd say like obviously it's like it's a marathon, not a race. Electives are like you're gonna do 8 weeks in ortho, like you want to kind of make sure you don't burn out really quickly. So yeah, like I think it's very doable to like work really hard and like spend a lot of hours on these things, but at the same time just have to balance it.
And we can see that you've balanced it. You're there. It all paid off, right? Um, Now that you're in residency, what's your schedule like? A lot of people would like to know that.
Yeah, that's a great question. And I think it probably like varies between programs. So I'll speak to what like U of T Ortho's first year is like. So we do um a few months of like arthroplasty, we do a few months of basic trauma, we do 3 months of off service, which I'm doing right now. So I'm on ICU. And then we do like medicine like GIM, like we do like a GIM hospitalist type of rotation. And then we also do an introduction or transition to residency rotation, which is the first 3 months of residency. And that's just like general ortho, just get placed at a site, learning how to like take call, handle pager, stuff like that. And then the first month of residency is also, I forgot to mention, like a boot camp that we do at Toronto, which is really nice. It's pretty unique to our program. It's like a month where we like learn all the basics of like ortho, from like both the content perspective, from like a surgical skills perspective. So it was also a good time to like get to know your co-residents and stuff like that. So yeah, like I'd say day-to-day schedule really depends on what site you're at, but generally you're pre-rounding or rounding on your patients around like 5:45, 6 a.m. You get in the hospital, you see your patients. You're usually assigned to like a staff or like a service in the actual ortho department, and then you round on that staff's patients. You make sure everything is okay. I like to come in a little early just to like, tee up discharge summaries and stuff like that, so I don't get called about it later on in the day that they're not done, just so that I can have peace of mind throughout the rest of the day. So just getting a lot of paperwork done. But at the same time, it's also really important to kind of make sure that, like the patient's blood work is okay. They don't have any like surgical complications. So it's good in the morning to try and wake yourself up to get through that. And then after that, we usually hand over anytime between like 6:15 to like 6:45, depending on the site again. Handing over really involves like going through what happened overnight on call. The residents on call usually just kind of like pull up the x-rays, pull up like pictures of like traumas that came in and try to try to discuss what they did and what's pending and what may need to be handed over to like the day team. And then after that, we have teaching, usually seven, and Toronto's really nice because we have a really structured teaching system at most, if not all sites. At least the ones that I've been to always have structured teaching where there's either fellows or staff that come in and give presentations on different topics. I know at St. Mike's, for example, where I was most recently doing ortho, like each day would be dedicated to a different subspec. Like, so like, for example, one day would be trauma, one day would be foot and ankle, one day would be like sports, right? Like we'd have like a very wide array of exposure, even if I'm not even doing those subspecialties, which is nice. So it's didactic teaching really. And then after that, usually the day starts around like 8 a.m., whether you're in clinic or OR. Those run from like 8 to 3, sometimes clinic or OR may run late, but yeah, like by 5, you should be out of the hospital if you're not on call. The other component of this is that someone is holding the pager on the resident team during the day as well. So if you are assigned the pager during that day, while you're doing those duties, you also have the pager to kind of attend to. So whether that's like the ward or whether that's like traumas that come in, if you're at a trauma site, you're the person that's going to step out of clinic and go and address those things. In the evening, you hand the person with the pager during the day hands over to the person overnight. If you're on call overnight, you're again holding the pager and it's pretty much the same thing. You're attending to consults, traumas, ward pages, making sure everything is attended to in a timely fashion. And yeah, you're could be, a very quiet night at some sites. They're like the ones that are not level one trauma, for example, are definitely not always as busy. But for example, Sunnybrook, I haven't been there yet. I'm going to be there in a few weeks, but that one will keep you up at night a lot. So like it really depends on the site, but again, call can be very variant depending on many factors. And yeah, you if you can get sleep, try to get sleep, but if you can't, then just try to power through the night, and then the next morning you're usually um, cleaning up whatever came overnight. If there's extra stuff that's pending, you're once you hand over, you just make sure that that stuff is like cleaned up for the rest of the day team, and then you can go home. So yeah.
Well, I mean, that was definitely a great sort of breakdown of your daily schedule. Although it sounds like what some people would do in an entire week, you do in a day. So that's honestly amazing. And I think you kind of mentioned the sites that you've been to so far. Can I ask what sites you've been to and kind of like what your experiences have been like at each of those sites?
Yeah, so I've again like I'm very junior, so I haven't been through many sites, but I've been to Mount Sinai for 3 months, and then I was at St. Mike's for 3 months. So Mount Sinai was honestly like to start residency off, it was really cool. I coming from McMaster, like I did a lot of arthroplasty at McMaster, so it was nice to kind of pick that back up and go to Mount Sinai and see kind of a lot of the complex arthroplasty cases they have, and they have some crazy stuff coming. They use a lot of like very specific constructs. Again, as a junior, a lot of it does kind of get really complex for the level of learning that you should be at, but at the same time, it's really cool just to be exposed to it. So I thought it was honestly a really good opportunity for me to see the real spectrum of like how complex arthroplasty can be. It's not just the same procedure over and over again. Like revisions, especially, can get very, very challenging, and even primaries can get very, very challenging depending on the patient's anatomy, right? So it was cool, and the staff there are all really nice, and I had a really good experience there in that 3 months of Sinai, I also actually got to spend some time at women's college. So some of the staff have like cross appointments, and I would be able to do some elective like arthroscopy cases or be a part of those, and also like attend some sports clinics, which was really nice. So sports med is also really really cool. Again, patient population is amazing, I think, and I think like getting my hands on with the scopes and stuff was awesome, and I am very grateful for that opportunity as like an R1 because we don't necessarily do sports until second year. So yeah, women's college is like primarily like an outpatient surgery kind of hospital where I got the feel for, what elective cases in sports are like. And yeah, it was really cool. And the teams there that were also amazing. St. Mike's Level 1 Trauma Center, I found it personally a bit more busy on the spectrum of things compared to Mount Sinai in terms of like how many things are getting like consulted for traumas that come in, just because they are level one trauma center, as I said like a million times. But they literally like it's night and day. Like you start there, I was particularly like, pretty nervous, and then about like, how am I gonna learn and be able to provide service. Like I felt like I was just starting out still, and I think, it really builds your confidence as a junior, being able to manage traumas independently, and kind of like from like a non-operative perspective, or like when you're actually doing the first response in the trauma bay. I think that gives you a lot of confidence and autonomy as a junior, which is really nice. And yeah, like reductions, like all that cool stuff procedurally, like I got a lot of hands-on experience with. And there they also have like, again, they have I did my arthroplasty rotation there, so I worked with a surgeon that specializes in like hip arthroplasty, and that was a good 3 months with him as well. He was great. So yeah, I think two very different sites, but again, I think the people there make the experience, and I think they were both amazing. So yeah, and I'll be going to Sunnybrook to end off my first year. So that will also be kind of a trauma rotation, and there'll be a lot of trauma there for sure, especially because it's going to be the summer, and that's when these things tend to really ramp up.
You're gonna be ending with a bang, Praveen, for
Yeah.
PGY. You talked about the sports med stuff. That's something like me and Rushal are like very interested in as well. He shadowed Dr. Marks last week in his OR, and that was like my second ever shadowing. So arthroscopy is something that's like super cool. I think especially for people who play video games. Me not so much, but Rushal's like a big gamer. So it really excites us. Speaking of gaming, we talked about how busy you are. Do you get time to game? Do you get time to do anything else other than be a doctor?
Yeah. Like gaming, not necessarily. I'll say like this, right? You get time to do stuff, and you have to pick and choose your battles. So, I sat down, and like once I kind of got accustomed to the residency schedule, which again, you never get accustomed to it because you're always changing sites. Like things are always going to be different in terms of your schedule. But generally, just being a resident, once I've kind of got that semi down at least, I was like, okay, I have some free time. Like, what am I going to do with it? What am I most like, what matters to me the most? Obviously, socializing and like hanging out with friends and stuff is something that keeps me going during the week. So I always try to make time for that. The other thing is, like I try to do things that are more active, like physically. Like honestly, going to the gym has been I've been much more like disciplined with it, I feel like, in residency than in med school, which is funny because I have way less time in residency. But I just because like when I kind of thought of it in that frame, like that my mindset, like I have to like put my time into a few things. What are those things going to be? I kind of realized that like time is so scarce, and I have to be very grateful that I even have like the opportunity to go to the gym. So that's something that I've been trying to keep up with, and then also like picking up new hobbies. Like I think people may say like it's hard to do as a resident in any specialty, but I don't know. I've had experience, and I've been able to pick up some stuff. Like running has been something I've kind of started to getting into. Like I know it's like very typical, like you move to Toronto in your mid-20s and you want to like run a half marathon, but like I definitely enjoy it. And now that the weather is getting better, I'm really trying to go out and like get into training at least for the half, hopefully by October. Like there's one in October, so that's the goal, to be able to run that one. But I've been training since like I've started my off service. So yeah, we'll see where that goes. But I'd say overall, like it's one of those things where you probably can't get everything that you want to get done, right? But if you were to kind of sit down and be like, what matters to you the most, I think it's a good way to kind of frame it so that you can really put your time into things that matter to you at the end of the day.
Yeah, absolutely. It's really funny how you said that you find more time for the gym now than you did in med school. I think that sometimes when you feel like you only have a certain amount of time, it really forces you to prioritize the things that really matter to you the most. So that perspective shift is really valuable. And obviously, like you described your schedule, like 5:30 a.m. to 5 p.m. A little less than 12 hours, probably more than that at times, and you add the call to that's a 26-hour shift, right? So it's clear that residency pushes people beyond their limits. So, I think those moments really kind of force you to self-reflect. So what do you feel like is one thing that you learned about yourself over the past year that you may not have otherwise kind of learned about?
Yeah, I think I don't know, like I think I've learned that um this is not necessarily about myself, but maybe just like how I've operated in the past. And I think is that I've had a lot of time on my hands, and I think residency just forces you to become so efficient, which is like nice. I think because it's like a skill that, you can learn, like you can learn how to become efficient with your time through a lot of things, but I think residency kind of like takes it into this like overdrive where you become so efficient that like once you're out of residency, I mean, I haven't had the experience because I'm not a staff yet, but like once you're out of residency, I can already imagine like once that time gets given back to you, you're only going to be able to like appreciate it more and like become so much more efficient with the things that you do just because like, you did so much outside of work in your limited time. And like at the end of the day, like you're like before I even mention hobbies and like hanging out and stuff, I think like the first thing that you should prioritize is like stuff that like, like eating right, getting like your meals in, sleeping, right? Because those things also will affect the way that you work on a day-to-day basis. And also like your health is obviously very important. I'd say like again, just being efficient is probably the thing I've realized. Like I have the potential to do so much more with the time I have. And it's not like one of those things where I look back in med school and be like, wow, like there have been times where I've just been like bed rotting and like I did not need to be doing that. But it does kind of put it into perspective, like especially when you do kind of come on, like for example, when I'm off service now, not to say that it's not busy, but it's more definitely like I found it to be a lot more like, you know, the hours are definitely like a little more controlled off service. And I found that I've been able to do a lot more than I probably would have been able to do a year ago with the time that I have outside of work. So yeah, just becoming efficient is something that I've really learned is possible with the schedule that I have.
Hmm. I kind of understand what you're saying, Praveen. Obviously, not to the degree that you're feeling it. But I think for us at U of T, going from pre-clerkship to clerkship, and I'm sure it's like this at Mac too, it's like a big, big jump. And especially the rotation I'm on, we went straight from second year to surgery, and that was like a huge jump. And it makes you realize how much time you had before and what you could have done with that time. And you were just like watching YouTube or like watching Netflix. But it makes me a lot more mindful of what I'm doing right now. So that's really good. Obviously, you're putting in all this work for a reason. It's to get to the goal of becoming a surgeon. It's to help your patients. Have there been any experiences in residency so far, where you kind of feel like, oh yeah, this is so worth it? What has been that like one rewarding story if something comes to mind?
Yeah, trying to think, to be honest. It's like I think, the one thing about residency that's nice is that you get to see patients like longitudinally because like in medical school you're only in rotations for like 2 to 4 weeks or like a bit longer. In residency you're there for 3 months. So like I'm not practicing independently, like I am part of a team. This is a team effort, so it's not like this is kind of my efforts that led to this. But like just in general, like seeing patients kind of pre-op that come in with the concern, like I remember like I remember having this one patient where I was on like my ortho rotations, and then they were pre-op for like an arthroplasty procedure, and they kind of had that same story that you mentioned, like they're a little older, they wanted to like be able to walk and be able to walk pain free, and it really got into day to day, like they wanted to hang out with their like grandchildren, and it was really like honestly debilitating for them, right? So it was definitely like that classic story that you see, but it was definitely memorable, just based on like how nice that patient was, and like how like we definitely had like really good interactions. And I was there for the procedure towards the end of my rotation, and then I actually saw them on my off service rotation, just because they were like, I think they were like a family member of another patient that I was seeing off service. And then it was pretty funny. Like I like once, and then they recognized me and I was like, oh shoot. Like, and then they were telling me how much the surgery has helped them and stuff like that. And it was like, it was really nice to see like months have passed by and like this is how much progress they've made. So I necessarily like, you always hear ortho is one of those things that has like immediate positive outcomes. But at the end of the day, like, you're as a medical student, you're not seeing these patients like 7 months in advance, even as a resident, to be honest, right? So that was a really cool opportunity, just by coincidence, that I ran into this patient, and it was really awesome to see that they were enjoying the results of their surgery. And then, I'd say another like I'd say rewarding experiences also just come from like like you being able to talk to a family and ease their concerns about like an urgent surgery that might have happened overnight. When you're the resident on call, sometimes you're the only person in the hospital that has like that is in orthopedic training or has done orthopedic training, right? So you're kind of seen as like the person that everyone is going to call, and it's a huge responsibility. So even like, there have been countless examples where I have, not countless, but enough examples where I have been in the hospital and it has been rewarding to be able to go down to the emergency department. Like there's like, even like we think of a wrist fracture, right? You do the reduction, you do a good job at the reduction, and being able to like walk them through before you do the reduction, like what they're getting themselves into and what a reduction actually is. And it's definitely like anxiety provoking, especially at 3 a.m. Imagine like having to kind of like the idea of reduction sounds pretty barbaric, I'd say, to like the lay person, right? So being able to explain what it is, what type of pain control will be provided, like everything like that, and sound like you're taking lead in the patient's care is really an awesome thing as an R1 at least. So I'd say those are some really rewarding things that I've at least experienced up to this point.
Yeah, that's amazing.
Yeah.
I honestly think that seeing the results of your surgery is something that not every every surgeon or every resident or every medical student gets to see. At least when you're part of that process. So it's really nice that you kind of got to see that, especially the long-term results of that. And even in the more short term, I think that uh, even like I shadowed in the in a ortho clinic once, and I saw that. Every patient walked in with like the biggest smile on their face, and whenever the doctor walked into the room, they were just like so happy to see him, because they knew that kind of he had the answers to all of their problems. And I think that that is something that really that simple interaction really helps patients a lot more than just like correcting their problems. It's more just like seeing that doctor and offering that solution. But on the other side to that, orthopedic surgery can be very emotionally demanding. So how do you manage the stress and associate with that and maintain kind of your well-being during those like long cases or challenging cases?
hmm yeah, that's a great question. I'd say, like a lot of ortho is very fast paced. So I found at least that sometimes it is, tough to kind of take a step back and think about like process a lot of the stuff that's going on. Just because you're like doing things so fast, especially at these like more busy centers, like you sometimes feel like you don't have time to kind of sit back and kind of like process just what happened. So I think the most important thing is, if something bothers you or something, you do need to take time to like kind of reflect on what just happened. Like you do that when it's an appropriate time to. And I think there's really supportive seniors and fellows and staff here that I've been able to do that with. Like especially your senior residents, like when you're on call and you're buddied up at these like more busy sites, like it's really nice to be able to talk to them about like what that, like specific case was, maybe things that you found challenging, like maybe you struggled on a reduction, for example, and you felt down about it, like talking about, like things that you can do in the future and stuff like that, and hearing like reassurance from seniors that, they've been in the position that, they've been in the same position before, like don't worry and stuff like that. It's really nice to kind of have that type of reassurance during your call shifts. So I'd say like yeah, like just talking to people, and then also your co-residents are really important to kind of rely on, and obviously like you get to know them better as the year goes on, and you get to talk to them about stuff that you guys mutually experience as R1s. So it's also really nice to have that as like a support system. But yeah, overall support systems are probably the biggest thing, and like that's another reason why electives are so important. Like, do you see this program having a support system that you can really, you know, fit into and use as like lean into like when you're actually a resident. It's good to kind of get those experiences even as a medical student so that you know what you're getting yourself into when you're actually a resident.
Yeah, yeah. It's hard to think about that way sometimes that you're also evaluating the schools while you're an elective, while they're evaluating you, because it just feels like much more of a power imbalance. but it's definitely one of the things that should be considered. You talked about support systems, and I think one of the most important things in like from when I was a pre-med to like a med student and then now hopefully going into residency is the mentors you have along the way, because they kind of make things a lot easier for you and prevent you from making a lot of mistakes. I'm sure you had a lot of mentors that pushed you in that direction, and you talked about some of them. Is there something you found really helpful from your mentors? Was there one particular mentor that really stood out to you? We're not putting you under pressure to mention one name because I know that that'll be mean to the others. But something that really helped you and how you want to take your own mentorship forward.
Yeah, I'd say like one person that really stuck out to me was like as a medical student was like our my home programs like program director, for example. I remember, like I discussed with him that I was interested in the specialty and I came late into it, and like at first he even, we even discussed like I remember doing like a 2 week, we have to do like a 2 week rotation. Everyone has to do 2 weeks in ortho, and like he told me like I was still pretty green. I still had to like, get my bearings and like, but he saw potential and stuff like that. And he invited me over for another elective in like August. So, I actually ended up doing another elective at that same site with the same guy. And like he, again, gave me the opportunity to do that and kind of encouraged me to do that. Because like, even though, he knew that I was still kind of getting my bearings, like he saw that, I could possibly improve a lot in the short period of time, and I had the potential to do that. And I think, um, long story short, I think that type of mentor is really important to have, like in, your early career, just because like you want people that see the potential in you and they won't like write you off when you're, really early. Everyone starts off at some point. And I think that was really nice to see. And I remember like, matching, like I was really grateful that I even had the opportunity to do that elective with him, because like um he like I don't know if I would have done it if he didn't give me like kind of put it in my mind to come back, right? So I think like that was really like important. And I mean, I had a lot of mentors in ortho in medical school, like that I picked up, like, for a variety of reasons, like people that are more like research mentors, people that are more like clinical mentors and stuff like that. So then resident mentors are also really important. How I see kind of my mentorship, I think like I'm someone that I want people to succeed and I want to give them autonomy early on. Like as especially like, as a junior resident, like I'm still trying to get my own bearings and like do procedures by myself, like in the emergency department and stuff. But I do want to get to a point where I am comfortable being able to have medical students participate more and more and like learn themselves. So that's also kind of like a motivation for me to really get my skills down, right? Because like I found that the best clinical mentors are the people that are really good surgeons themselves and, can give, like their learners opportunities to do things that are hands-on, because they know that they are very confident in their own skills, that if something were to happen or something were to, they can anticipate it before something goes wrong, right? So yeah, I'd say that's a big thing in my mentorship, like being able to, be a really, really, really good surgeon myself so that I can give the opportunity to others to also learn. And then the other thing that I mentioned in terms of autonomy, I think it also can be applied to like an academic perspective. I love, I love research. I love being able to like mentor students through research. And I think I want to be someone that gives students autonomy to be able to kind of like conduct their own projects. And that largely comes from a mentor of mine that, as I mentioned before, it gave me the autonomy to do that. And it really worked out. So I'd say that's also another thing that I kind of incorporate. And then at the end of the day, I'm also very interested in like the equity aspect and like bringing more diversity into orthopedics, so people with like shared experiences, lived experiences. I mean, like I was the first person in my family to go to university, so I can understand that coming into medicine is really, really tough in that sense. And when I was kind of a pre-med myself, like I relied on a lot of people outside of kind of like my family and just like friends that were in upper years, for example. And I found that really helpful. So I kind of also want to be there for people that are very, very early on and are interested in medicine at the very slightest bit.
That's very kind of you. And, also from both me and Nimit, like we are both also the first people to kind of attend medical school in our family. And I think that the lack of knowledge and resources and connections kind of make the path a lot more challenging. And I think that it's really important to, connect with people like yourself who share the same experience and are also looking to kind of give back and support the medical community in as many ways as possible. And I think another thing that resonates with me that what you said was about potential. And I think that people that write people off very quickly kind of like lose that idea of potential and just for someone who may have been way more interested in the specialty if they were given like more autonomy and more things to do or just more insight into the specialty really make a huge difference. So I think those are definitely it's definitely good advice and a good sort of outlook on the way to pursue mentorship. But shifting gears a little bit, the future of orthopedic surgery and the future of most specialties, the talk of the town right now is AI and robotics, right? People are thinking like AI is going to replace this specialty or things like that, right? So, but the reality is, these are just tools that are meant to support us in our clinical expertise. So, how do you see AI or robotics kind of changing orthopedic surgery in the near future, if you're kind of in that sphere? And are there any specific sort of devices or technologies that you're excited about?
Yeah, so that's a great question. I'll preface like I'm not an AI guy. So I may not have the most technical knowledge, but I totally agree. Like I do see the potential for it to change practice. I'd say, like not even AI, but like even robotics, I'd say like robotic surgery is really, really like up and coming. And as a resident, being involved in those cases is really cool because you have a bit more of an understanding of like again how we talked about. I think I mentioned before like different types of alignment, arthroplasty, for example, and how that might relate to like the robotic arthroplasty techniques that we use. So generally speaking, I think that like the precision that comes with robotics in like joint replacement, for example, is unparalleled. Is it a different type of surgery that maybe some surgeons may have to become accustomed to as they evolve their practice? Yes, it's very different than, doing it all by your own two hands. But at the same time, I think precision is really, especially with patients that have like very difficult anatomy, like that that can come in very, very handy. So I think the biggest thing with these technologies is that in medicine, and this is like one of the reasons why I even went to medicine, is like you can't apply the same algorithm to every patient, right? So, like, again, very generally speaking, I think that these technologies can come in very handy, but at the same time, we can't lose track of like the individualism that goes into our treatment plans and surgical plans for patients. But I do think AI in itself lends itself well to that because it does take that into account. Like that is the whole premise of AI. Like it takes prior information and it tailors information to kind of predict outcomes or like predict what needs to be done for a certain surgery for a certain patient depending on their own factors. So yeah, I know that was a very general answer. I just literally do not have like the most background knowledge in the specifics of it. But there are residents in our program that are very interested in that stuff. We can give a lot of insight, probably better than me. But I do think that it is huge in ortho, and like as a resident, I have seen it being used time and time again. Um, Other technologies that I'm particularly really excited about, um, I don't. Hmm. Yeah, I'd say that. If I can think of something, I'll get back to you guys about that. It's not something I actually have thought about too much, to be honest. I feel like technology in ortho is really, really cool just in the way that it is already, right? It is one of the reasons why I went into it. Like what other specialties using like these big saws, hammers, drills, and like it is pretty enticing for medical students. So like there's probably so many other things that I can think of. I just if I think of something that's really cool and like I've encountered, I'll let you guys know. We'll circle back to it.
No, that's a hard question anyways,
Yeah.
Praveen. Kind of put you on the spot with that one. But I'm sure you'll come with a great idea and you'll probably patent it and become like this big star because of that. Uh, we wanted to end off this interview with more of a fun question. All the answers you've given have been like super, super insightful, and I think it's going to help so many medical students. But I just wanted to ask you this one question. So it's about a puzzle, actually. So we're not philosophers. We just saw this on a show, WandaVision, a few years ago. It's called the Puzzle of Theseus, where basically there's a ship, and if you replace this wood ship, it's made with wooden panels, and they replace every panel with a metal panel, and it's still the same ship. Would you say it's still the same ship at the end, even though it's now all metal and it used to be all wood before? So I think, as an analogy, if you kind of replaced every joint in the body and you replaced every bone in the body, are you still human or are you cyborg?
Yeah, I think you're still human, to be honest. Like, I think, that is the whole thing with a lot of these like joint replacements. Like, when you guys if you guys hopefully do end up in ortho and you learn about the different biomaterials that are used, like the whole advancement of biomaterials. Like I remember hearing that they used like the first ever, I don't remember if it was a hip replacement or the knee replacement, the first ever was done with like wood or something, right? And now, they've progressed to different types of metals, like they've done ceramics, like it's they use a lot of different type of materials like cross-linked polyethylene, like it's all these, like it comes from what are the most biocompatible materials with your body, right? So I'd say like from a very, very theoretical standpoint, like I mean, not theoretical, like from a very practical standpoint, like I know it's a very theoretical question, but I'd say like the whole point of, why we advanced how we like use implants is like to kind of fit that thing where like we're trying to make it as humanly compatible as possible. So I'd say, yeah, you're still human. And I think the other component of that question is like, at the end of the day, what matters to the patient, right? Like, I don't think any patient, I mean, like it's a pretty big deal that they have, metal in their knee now, but I don't think patients necessarily focus on that as much as, at least most of them, they don't focus on that as much as the pain release that it provides and like them being able to go back to their day without as much pain or as with a lot more functional like capacity, right? So, to the patient, I think they feel more human than ever. I feel like, their human was what they were like when they didn't have like osteoarthritis, or when they didn't have that knee deformity, right? So I think like also from the patient's perspective, which honestly at the end of the day is what matters the most, like they they become like they feel more human than ever. And I mean, I can't like say that with 100%, vindictiveness because I've never had like a joint replacement done, but I can only imagine, like, just based on my experiences hearing from patients that have gone through the thing, like it is really kind of like getting their sense of humanity back, just being able to do the things that they loved doing before and kind of being able to go back to live their life. So yeah, that's pretty much it. And we again, like I know I keep bringing this example up, but like there's many different orthopedic principles and like sometimes you like to mimic the patient's initial original anatomy, but to do that you have to um or sorry, sometimes you like to kind of, like for example in arthroplasty, I think I mentioned like kinematic versus like mechanical alignment, for example, and like just very quickly speaking, just for time purposes, like mechanical alignment, you're not recreating the patient's like original joint line axis between their hip and knee. And you are actually changing it. Again, it is very mechanically like advantageous. And you're not just doing that for no reason. But at the same time, to get to that, you have to do things like ligament releases. You have to, do soft tissue releases, which are at the end of the day invasive, right? Then there's something like kinematic alignment, which, you don't have that same like theoretical, like mechanical advantage that you do with like kind of aligning the mechanical axis the same way that you do in a mechanical alignment, but you try to mimic the patient's original anatomy. And like all of this is to say, like this question is something that's continuing to be like explored in orthopedics. What do we actually want to do at the end of the day? But it's very nuanced, and that's a whole conversation that we can have in itself. Overall, I think, to answer your question like very definitively, like yeah, I think patients feel like they're more human being able to do things that they did as humans before, their quality of life went down with these illness or these ailments. So I do think that they still are human. And although I don't know, maybe they may feel like a cyborg. I don't know, but I think at the end of the day, it's that is an interesting question though.
Yeah, so you're what you're basically saying is we're not becoming the robots, the materials are becoming us. So
Yeah.
we're going the other
Yeah,
way.
that's a good way to put it. That's a good way to put it. Yeah, like I mean, and then like it's really tough because I mean we're just talking about arthroplasty. Like like there's so many other implants that are used in a wide variety of subspecialties. But at least for as far as arthroplasty goes, because we're talking about joint replacements, I'd say that's it. I'm also not an expert in arthroplasty, so maybe if you ask like an arthroplasty surgeon, they'd say something completely different. But yeah.
No, we loved all of your answers and we had a great time talking to you, Praveen. We really appreciate you taking the time out to do this. We know you have so many other things and you chose to give us an hour. That means a lot to us. So thank you so much for coming out. I'm sure our audience will find this super useful. And I wish you had a great time too, and it wasn't just us learning stuff.
No, 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 this is great. Yeah, I hope this reaches out to people and they know a little more about ortho. I'm happy to talk more about it. I can give my email or something and then yeah, we can go from there.
Yeah, great.
Yeah.
Okay. We'll see you next time, everyone.